right, so good afternoon, class. So we're going to start with anti-emetic and anti-nausea drugs. So just as an overview, we'll start vomiting process. So what's is involved in the vomiting process? So you have a noxious stimuli, which stimulates the neurotransmitter signals, which causes your CTZ to hit the vomiting centers, which then initiates the vomiting. So your chemoreceptor trigger zone is what is stimulated in order to initiate the vomiting. Your CTZ stands for your chemoreceptor trigger zone. So just as an FYI when we refer to it. Your neurotransmitter signals, they can originate from several areas. Areas that they do originate from is the GI tract. So your prokinetic drugs, your serotonin blockers are all going to be affected in this, affect this area. Your inner ear can also originate these transmitters. So your anticholinergics, your antihistamines, your antidopaminergics, and your prokinetic drugs are all going to affect this neurotransmitter site. Your cerebral cortex is also going to be a transmitter site, and your THC, your corticosteroids, and your benzodiazepines affect this area. And your chemoreceptor trigger zones are also going to be specific neurotransmitter signal sites, and those antidopaminergics, your prokinetic drugs, and your serotonin blockers are going to affect these chemoreceptor trigger zones. So that's where these trigger zones actually originate from. So your anti-emetic drugs, their effectiveness increases when more than one pathway is used. The primary goal of taking these drugs is to minimize or prevent fluid and electrolyte disturbances because they're not vomiting everything out, or they minimize the deterioration of the nutrition status. So from the lack of nutrients, if your patients can't take or keep anything down, they're not getting the nutrients that they need from the food, and so then it's going to affect their nutrition status. So we start with your anticholinergic drugs, so your scopolamine. Your scopolamine is a patch that is placed behind the ear. Again, the mechanism of action is going to block the acetylcholine receptors in the vestibular nuclei, which is in your inner ear. It's going to interfere with the transmission of nerve impulses traveling from one vestibular apparatus of the inner ear to the vomiting center in the brain. So that's how it works. It dries up all GI secretions. It helps to reduce smooth muscle spasms, and that's how it will help to decrease that stimulation of the trigger zone and reduce vomiting. Indications, why we use scopolamine: we use it for motion sickness or post-op nausea and vomiting. It can be given PO as a patch, IV, or also sub-Q. Your adverse effects that you will see, it can cause dry mouth, it can cause urinary retention and constipation. These are all your known anticholinergic effects. Sedation, it can also cause sedation, and you want to avoid activities that require alertness. Contraindications, why we don't, patients that we don't give it to, again, you want to give these patients with caution with those that have glaucoma. which is an increase the angle, which makes glaucoma worse. You want to be cautious with patients with asthma, urinary retention, or obstruction because it can accentuate these symptoms. Interactions. These scopolamine can interact with your antihistamines, so you will have an increase in your drying effect. It can interact with your CNS depressants, so it can increase the CNS depressant effect. Patients are instructed to avoid alcohol or opioids because it will accentuate or increase the sedative effect that these elements have. Nursing considerations. You want to make sure that the area is clean and dry. When you place the patch behind the ear, you want to replace the patch every 72 hours. You want to monitor your urine output. You want to monitor eyes and nose. You want to palpate your lower abdomen. Make sure that there is no bladder distension. The patch is applied several hours before surgery or 4 hours before you actually are traveling if you're taking it for motion sickness. Patient teaching. You want to make sure you're teaching your patients to increase fluid intake, suck on a hard candy or chew gum because of the effects of the dry mouth, increase physical activity or give a laxative, again, to help prevent the constipation. Make sure your patient's avoiding at least every 4 hours to help prevent urinary retention. Avoid the tasks that require mental clarity or the use of motor skills because it does have a sedative effect. Placement of the patch. You want to rotate your sites, non-irritated skin. You want to wash your hands before and after. You want to change every 3 days. If the patch does come off, you want to clean and dry the area and then place a new patch over the same area. So your antihistamines, your meclizine, dimethylhydranate, your diphenhydramine, and your hydroxyzine are all going to be similar to your anticholinergics. These are all antihistamines. These work by inhibiting the vestibular stimulation in the inner ear, the muscarinic and the histaminergic receptors in the nerve pathways that do connect the inner ear, and the VC are then blocked. So they do potentiate the anticholinergic activity. So it dries up all secretions, not just specific ones. Indications, it can be given PO, IM, or IV. And again, we give it for patients with vertigo or motion sickness. Adverse effects, again, dry mouth, urinary retention, and constipation, all your common anticholinergic effects. Sedation is another adverse effect. Again, you want to avoid your activities that require alertness. Contraindications, so again, caution with patients with glaucoma because it makes it worse, asthma, urinary retention, and obstruction. Lactation, again, it will decrease the milk production, so you don't want to give these meds to women who are currently breastfeeding. Interactions, they might have an interaction with CNS depressants, so it will cause the increased CNS depressant effects, so it will cause an increase in those effects. It will interact with your antihypertensive, so it will cause further hypotension, and it will interact with your anticholinergics, which will cause further anticholinergic effects. Antihistamines, again, nursing considerations: monitor your urine output, your eyes and nose, palpate for lower abdomen to make sure you don't have bladder distension. Age, your younger patients may have their paradoxical reactions, which is an opposite effect of what you would normally expect to happen. And then your older patients may have mental confusion or agitation. They might show more signs of hypotension and more types of psychotic types of reactions. So you need to kind of be, careful and cautious when you're giving it to these patients, and look out for these types of reactions. You also want to monitor your patient's blood pressure, because it will tend to lower the blood pressures. Patient teaching with these meds, again: increase fluid intake, suck on some type of hard candy or chew gum to help treat the dry mouth. Increase physical activity or give a laxative, which will help to prevent the constipation. You want to make sure your patient's avoiding every 4 hours, which will help to prevent urinary retention and avoid tasks requiring any type of mental clarity or use of motor skills because of their sedative effect. So your anti-dopaminergic drugs are going to be your prochlorperazine and your promethazine, which is your Phenergan. The way that these work is that they block your dopamine receptors in your chemo receptor trigger zones. They have an anticholinergic action, so it dries up your secretions, and it calms the CNS, so it does have a sedative, a bit of mental confusion. Patients can seem to complain of being in like a brain fog. Indications, again, they can be given PO, IM, or IV. And we give it to patients that have emesis related to chemo, related to opioids, or post-op. When it's given for chemo, it's usually given prior to the treatment. It helps to be more effective that way. Adverse effects, again, sedation. So teach your patients to avoid activities that require alertness. You might see your extrapyramidal symptoms, those involuntary movements like spasms of the face, the neck. You want to teach them to alert the MD and to stop the medication as soon as they see these types of symptoms. It may cause hypotension, so you want to make sure you're assessing your patient's current blood pressure meds and what blood pressure meds that they're on. You want to again teach your patients about your orthostatic hypotension precautions, and also the adverse effects are going to be involved with anticholinergic effects, your typical dry mouth, urinary retention, and constipation. And with urinary retention, make sure your patients, you're teaching your patients how to prevent urinary retention by making sure that they're avoiding every 4 hours or that they're drinking plenty of fluids. Contraindications that you might see with your Phenergan, you want to use them cautiously if at all with children and older adults because of the risk of your extrapyramidal symptoms. Your promethazine, you do not give for children under 2 years old. And again, you want to be cautious with patients that already have some type of urinary retention or obstruction, patients with asthma, and patients with glaucoma, because just like your other anticholinergics, it will make the glaucoma worse. Interactions that you will see, again, CNS depressants will cause an increase in your CNS depressant side effects. Antihypertensives, it will cause further decreased blood pressure, decreased hypotension. and it will also have anticholinergic effects, which will causes further anticholinergic effects like your brain fog and your symptoms in that fashion. So you have your nursing considerations that you are going to think about when you're giving these meds to your patients. Again, look for signs and symptoms of dehydration or electrolyte imbalance. You want to take your patient's vital signs. Again, they do have a potential for your orthostatic hypotension and tachycardia. So you want to evaluate a level of baseline vitals. You want to have a baseline CNS assessment. So when you're assessing for those extrapyramidal symptoms, you know what their baseline CNS assessment is. You want to monitor patients for extrapyramidal symptoms, and again, monitor your patients for anticholinergic symptoms, especially your urinary retention. Teaching that you want to do for your patients, again, educate on ways to prevent these anticholinergic effects, so increasing fluid, physical activity, laxatives. Want to teach your patients to avoid alcohol and other CNS depressants because it will aggravate these sedation symptoms. And you want to have them limit caffeine because having caffeine can cause dehydration, which because of the fluid and the urine retention, it will cause dehydration. And then also avoid driving and activities that do require mental alertness because of those sedation side effects. So your prokinetic, which is your metoclopramide, another anti-dopaminergic. These anti-dopaminergic now, they work by increasing your GI motility. So it empties the stomach quicker, which decreases the feeling of nausea because there's nothing in it to vomit. Indications that we give these meds for, again, delayed gastric emptying or reflux, patients with GERD, patients with diabetes, gastroparesis. We can give it to those patients for post-op nausea and vomiting, those patients with chemo, nausea and vomiting, adverse effects that you will see, those extrapyramidal effects, dystonia, akathisia, Parkinsonium, and bradykinesia, tardive dyskinesia, all involuntary movements. If they start to see any of these extrapyramidal effects, you want them to stop the medication and call their doctor. Sedation and diarrhea, if there's, remember, you want them to avoid activities that require alertness. And with the diarrhea, you want to monitor their stools, especially if the diarrhea is persistent. It can cause dehydration, so you want to be able to monitor them for signs and symptoms of dehydration as well. Contraindications, hypersensitivity to paraben or procainamide, some liquid forms, certain paraben, they are structurally related, so they can have a hypersensitivity reaction. Patients with GI disorders like a bleed or obstruction or perforation, these conditions may be aggravated by increased GI motility. Parkinsonians and seizures, they could have an exacerbation of these CNS and motor dysfunctions, so you don't want to give it to patients with these conditions. And you don't want to give it with patients that have renal impairment because of the potential for increase in accumulation and toxicity. Interactions, how these antidopaminergic interact. They do interact with alcohol and CNS depressants. Again, they do increase the risk of seizures and sedation. They interact with opioids and other anticholinergics, so you might have a decreased action of the metoclopramide. Nursing considerations, assess for contraindications, so you want to make sure you're assessing your patients if they have seizure disorders or GI obstructions. You want to know what type of hypersensitivity to drugs that they have. They might have a hypersensitivity to Priapen or procainamide. So you want to assess for that. Assess for motor and neural function, because of the increased risk of extrapyramidal effects and the CNS depression. You want to have a baseline and monitor renal labs, because it can have an increased risk of toxicity if they have some type of renal impairments. How we give it administration-wise, you want to give these 30 minutes before meals or at bedtime. You want to keep the IV solutions only for about 48 hours. Protect it from light and properly dilute the medication. And you don't want to give with other meds because of the exacerbation of extrapyramidal effects, and you might not know which effects, what's causing the effects, or is it this drug or other drugs that they might be on. Patient teaching, again, report any involuntary neurologic movements, signs and symptoms of your tardive dyskinesia. You want to take 30 minutes prior to meals or at bedtime, and do not take with any opioids. Then we have your neurokinine blockers, a prepitant. These work, they are antagonized substances. So antagonize means inhibit. So they antagonize substance P, neurokinin 1 receptors in the brain. So it's a specific neuroreceptor in the brain. Indications why we give this med: it prevents nausea and vomiting associated with chemotherapy, helps to prevent post-op nausea and vomiting. It will extend the duration of action. It has an extended duration of action, so it's effective for immediate and delayed responses. It often used in conjunction with your serotonin blockers or your glucocorticoids. Uses a different pathway, so they can both be used together. Adverse effects that you will see, it can cause headaches. You want to treat those with opioids. May cause fatigue or dizziness. May cause diarrhea. So you want to monitor that stool pattern and possible liver damage. So you want to have liver function test. Interactions, it will decrease the concentration of warfarin. So you want to make sure you're checking your INRs and your PT of your patients that are on warfarin. You will increase the concentration of the corticosteroids. So your dexamethasone, your methylprednisolone are all corticosteroids that it will increase its concentration. Contraindications, PO and IV, you want to use with caution with children that have severe liver and kidney disease. And again, nursing considerations, you want to monitor for any type of potential interactions. You want to monitor for those adverse effects. And you want to look at the dose very carefully. Dose changes depending on the day of therapy. So you usually start out with a larger dose and then you go to a lower maintenance dose. Your other med in this class is going to be your serotonin blockers, your ondansetron. Anything with the ending citron is going to be a serotonin blocker. Mechanism of action, it will block serotonin receptors, stopping the emesis signal. It blocks serotonin receptors that travel from the upper GI tract to the chemo receptor trigger zone. It's going to prevent the signal from getting to the CTZ, blocks the serotonin receptors in the CTZ. Remember, CTZ is your chemo receptor trigger zone, which is what stimulates the vomiting center. Indications why we give it: we can give it PO, IM, or IV. We give it for chemo-induced or radiation therapy, nausea and vomiting, and we give it for post-op nausea and vomiting. Adverse effects that we might see: headaches, diarrhea, and dizziness. So you want to monitor your stools. Give a non-opioid analgesic for a headache. And it could cause prolonged QT intervals, so it can lead to cardiac dysrhythmia. So again, monitor your EKG in patients that have some type of cardiac disorder. Serotonin blockers, their interactions, again, they're going to interact with other serotonergic drugs. So drugs that increase your serotonin levels, SSRIs, SNRIs, could cause serotonin sickness. So they're going to increase those. So those serotonergic drugs are drugs that you don't want to give with giving your serotonin blockers. Contraindications: congenital long QT syndrome, at a particular risk for developing Torsades de Pointes, and Torsades de Pointes is sometimes fatal. Sometimes fatal heart rhythm. It's a specific heart rhythm that they will get, and it can be fatal to patients. So it's a contraindication if they have this rhythm or get this rhythm. Nursing considerations: you want to place the EKG on patients with electrolyte disturbances, so patients with decreased potassium, decreased magnesium, CHF, bradycardia, patients taking meds that could lead to a prolonged QT interval. Those patients need to be observed while taking this med much closely. Signs and symptoms of dehydration, electrolyte disturbances, you want to monitor for, and you want to monitor your heart rate and your rhythm. How we give these serotonin blockers: so you're going to give them 30 minutes prior to any type of surgical procedure, or 30 to 60 minutes before administering the chemo. You can give it IM in a large muscle, or IV over 2 to 3 minutes, or you want to infuse it, slow infusion over 15 minutes. Patient teaching: again, you want to warn about the cardiac dysrhythmias. You want them to know to avoid alcohol and other CNS depressants, because it will increase those CNS depression effects. You want them to know to avoid activities requiring mental alertness or motor skills, and you want them to know to take these meds 30 to 60 minutes prior to their treatment. Okay, so your other class, your tetrahydrocannabinoids, which is your dronabinol. It is the synthetic derivative of THC, which is a primary psychoactive component. THC is the primary psychoactive component of cannabis. This is a second-line drug. It's used only when others have failed. Mechanism of action is really unknown. We know that it does work on the cannabinoid receptors. Indications: we could give the dronabinol to help increase the appetite in patients with AIDS. It helps to aid in weight gain. You want to decrease, it does decrease, or we give it for when we want to decrease nausea and vomiting in chemo patients. Adverse effects that you will see, disassociation or dysphoria, hypotension, and tachycardia. Contraindications, again, avoid client doing anything with that requires giving these meds with that have our clients that have mental health disorders because of the psychoactive component, and caution with those clients with cardiovascular disorders as well. Your dronabinol, the nursing considerations with this drug, again, monitor heart rate and blood pressure. It is a PO form only. You want to give it 1 to 3 hours prior to chemo. And again, you want to teach your patients to change positions slowly because of the risk of hypotension. And you want to caution when engaging in activities that require mental alertness. And these are your resources. Okay, so I hope you enjoyed this lecture, and we'll see you all next week.